can't take the science out of it completely.
No,
because
nor
can you take the politics out of it.
You can't take the science or the politics, but...
And we can't take the two apart, because in 1971, President Nixon threw down the mantra and said, declared as one cancer. In 1997, the Senate, 98-0, voted to arbitrarily say, we will support funding of mammography for women 40 to 49. Arlen Specter had his hands in deciding whether NCI would go ahead and get further funding. And now we're looking at politics again. So politics and science are always enmeshed, but I would argue that we are on the verge of becoming a scientifically illiterate country if we don't at times separate the two and really talk about that.
You made this point speaking on Morning Joe on MSNBC this week. We just came out of October, what I call the pinking of America. We have taken a woman's breast and we have politicized it. We have marketed it. We have made millions of dollars for agencies and nonprofit groups off the breast, but in some ways we've not let women know the data.
That's right.
And I don't think anyone's pushing back on the data. What I think
but wait
a minute. I think people understand the data. I know we're looking very, very carefully. But here's the data we wouldn't have been arguing all week long. Nobody's also studying the real behavioral side of this. Again, we have acculturated a generation of people to become active in their health care. There is a huge public health piece here. And as far as the pinking of America, I have one thing to say. There's not enough pink in America, David. If there hadn't been red in America, we wouldn't have had antiretroviral drugs.
There are people with other illnesses who think that perhaps the pinking has sort of taken over. But it's...
But why is it bad for the behavioral piece for the government to say, look at your case individually, and if you're in your 40s, you may not need a mammogram? Why do you think that inexorably stops the momentum for mammography testing?
Because with all of our experience, David, on the ground, I've been doing this for 30 years. Our organization is active very, very much all over the world. And I will tell you that changing people's health behavior is a fragile proposition. And so that I'm worried again, mostly at the women, the low-resource women who've now been brought into the system, who are engaged in some way in good breast health care. We have to do these things carefully. We have to look at the evidence-based science, and we have to translate to the best of our knowledge.
Back to my, should the government stay out of this completely in terms of setting health care standards?
Well, again, I don't want to politicize it. I don't think the government.
How can you say you don't want to politicize it?
I don't think the government should stay out of it, David. But I also think that people have to be very engaged with the government. That it shouldn't just come down as a mandate.
You're petitioning the government, and you're engaged in politics all the time, which is not a bad thing, but it's a reality.
But the fact is,
the fact that the American Cancer Society has lobbyists, the fact that you have lobbyists, that is an absolute statement that there are politics enmeshed in advocacy groups and in setting standards. So, I mean, we can't be politically naive about this. There are big stakeholders in this.
And Dr. Nancy, should the government be involved in making this decision?
I mean, look, as long as there's Medicare, the government has to be in it. But we should but there should be greater transparency. And I think
greater transparency and continuation of advocacy. If we don't have patient advocacy, we're not going to get to where we need to get to.
We're going to make that the last word. I'm sure the debate will continue. Thank you both, the two Nancys. Up next.